It's National Health Center Week, and eClinicalWorks is proud to partner with organizations across the country that are so often at the forefront of caring for communities and patients with the greatest need. Joining the eClinicalWorks podcast today is Geli King-Brown, Senior Director of Quality Management at Healing Hands Ministries, to speak about the ways in which HHM is advancing their mission on a roadmap to a stronger America. Geli, thank you so much for taking the time to speak with us today.
Absolutely. Thank you for having me.
So Geli, first, I think congratulations are in order. I understand that HHM is expanding its locations and services. I think I speak for eClinicalWorks when I say that we're glad to partner with you in that and give you the tools that I think are helping you to do some of those things. Now, HHM doubling its footprint, I mean, doubling your locations, doubling your service lines, that is a lot to add simultaneously. And my guess is that it would be very difficult to do those things without a really strong set of policies and well-organized teams. Now, I know you have PCMH recognition. What link do you see between the PCMH program and HHM's ability to achieve that goal?
Oh, goodness, everything. So patient-centered medical home, PCMH, allows you to set up that structure and foundation that you can take and copy into every location that we open after that. So we are able to establish set policies, procedures, workflows, how we document things, everything gets standardized, which really makes it easier when you're expanding and opening new locations because the staff already have a template to work from. The way we approached PCMH is we started with our initial family practice, set all the structures up, and then every year since we've added our additional locations so that all of our locations are recognized patient-centered medical homes. And I'm super excited about being able to bring these new locations in, and then having a software like eClinicalWorks just makes it that much easier for me having to do this whole process because we're able to integrate all of our services into one electronic medical record system. So our vision, our imaging, our behavioral health, our dental, and our medical are all using eClinicalWorks. So it helps us to be able to see across service lines, to be able to integrate services, and be able to give that holistic approach of care to our patients, which is the initiation of PCMH.
HHM employs PCMH analytics and HEDIS analytics to help you with your PCMH recognition processes and other processes. How has your PCMH recognition process changed as a result of having those tools in place? Does that allow you to do things you couldn't do before?
Oh, absolutely. So part of PCMH is the QI portion, which as a quality person is the most important, I feel, of the whole structured process. But in that process, it's being able to identify subgroups of your patient population that have specific conditions or diseases to be able to show the QI process that surrounds that group. For example, we're able to take our diabetics, peel out those that have had diabetic eye exams. Those that have not, we send over to our vision center for eye exams, and all of that information just folds right back into our system. So we have it right there for the complete or thoroughness of that diabetic patient. Then we can run that report to show this is where we started with our diabetic eye exams. Here's the process that we use where we run a report, give it to our vision folks. They call and get those patients scheduled and get them in for that diabetic eye exam, send that report back to the primary care physician to review and make any adjustments to the diabetic care management process. And here's where 3 months later, here's our outcomes. So my whole QI section is really a lot easier to pull together because I have all the tools in place already.
Now, I do want to make sure that people who are watching this know that you mentioned 3 months later you have your results. Well, the HEDIS analytics, as you know, updates every single week.
Yes.
And by the users conference this year, it should be updating every single night. So we're very excited to see that.
Oh, wow.
Oh, news for you. Okay.
Yeah. Yeah.
Maybe people watching this in the future, they'll say that's old news, but this is very exciting development for this year. Now, what does that do for your ability to get those practices recognized? How does that change that process for you? What was it like before you had the PCMH analytics, and what is it like now?
Well, I've been doing patient-centered medical home since about 2010, 2011. So I was a part of that whole manual paper printout. You could judge by the stack of papers that you had done everything you needed to do or not. So to see the revolution of even the PCMH process to now having with eClinicalWorks embedded reports that I can just click and run that gives me all of that information that I had to manually scrub through or manually track before, such as telephone encounters, the timely response to those. All of that's just right there. And I can just run a simple report using the PCMH report module in eClinicalWorks. So now I have all of that. So it has cut what used to be probably a 3 to 4 month process, just collecting all the paperwork for PCMH submission. Now I can get it done in a week for multiple practices. So it is really a game changer for me in my world. It has been great.
That's a strong efficiency multiplier, it sounds like. Now,
Yes.
buy-in from your side is one thing, but engagement of the providers and the users is a totally different thing. So what strategies are you using to get your teams to engage with all this information, those quality measures, the PCMH reports, things like that? Have you found that this data helps to increase their performance overall?
Oh, absolutely. So, folks are always looking for that with them. What's in it for me? Why do I care about this? Why do I want to care about this or need to care about this? If you just show numbers, people don't understand. So you have to really show them why it's impactful. So when I can show them that, by responding to your phone calls within the time that we've defined, we have increased our retention of patients, or we've reduced our no-show rate, that starts to mean something to folks. When you can show them subcategories of population of our patients that have transportation concerns, it starts to explain why they're missing their appointments, because now we have that information that we can share. Or you can start to manage them better. Or maybe it's the medication adherence. So now we can look at what pharmacy are we sending it to? Maybe we need to put them on auto refills so that they don't forget to go pick up the medication and not take it for a week because they can't get over to the pharmacy to get it. So when you start to really break things down and show folks why they should be so invested and why it's so important for them and what they can really do with the data and the reporting that we have access to now, they really start to embrace it. And now it's not just, the Gela show running the PCMH reports, but now I've shown our teams how to run those reports. So they're coming back to me saying, hey, Gela, I ran this report and it's showing this. So I'm going to look at this, these things and start working on a game plan of how we can improve that later on. So it really allows you to be holistic in your approach to the patients, but also inclusive with your staff to be able to share outcomes across the board. And then it becomes kind of fun because you can say, well, this clinic did better than this clinic on this metric. And now you have the internal competition that, really drives folks to want to improve, and they want to be at the top of the leaderboard next month. Teach back is a strategy that I've used for many years. And when peers are teaching back to each other, it takes on a different spin. It's not just the quality person telling them, but it's someone that's right there in the clinic working next to them. So we do have providers that champion certain metrics, and we also have staff, so MAs and our nurses that champion certain things. Maybe it's an education, maybe, for HPV vaccinations, for example, they actually champion how to speak to those parents to help them understand the importance of getting that vaccine for their child. So that really helps because then everybody has something to contribute and everybody can learn from each other. And then we highlight those either care team champions or provider champions or clinical staff champions.
So Gela, how are you measuring your success with the PCMH and the quality measures? What results have you seen since earning the PCMH recognition as far as HHM goes as a whole?
this is where our HEDIS dashboards come back into play. Is we've set a lot of those metrics on our HEDIS dashboard to marry and match what we use for PCMH. So we're able to monitor and gauge our performance over time, and we've set internal goals. So maybe this year we were performing at 60%, but next year we want to hit 75. So now we have a new goal internally that we want to strive to show that we're improving over time. And that's shared every month. We share our dashboards with all of our staff, and then we trend our data every quarter because, it takes more than a month to really move the needle. So we trend that and do analysis on that every quarter and share that to all of our clinic locations and with our patients even, because the patients should care that we're doing really well with diabetic management. They should care that we have really good outcomes with hypertension management, so that they can trust us to really take care of them, their families, their friends, and so on and so forth. So we really like to use those dashboards to show where we are progressing and where maybe we're struggling, so that we can put some more attention and focus on those areas, or even determine what's the root cause. Why are we struggling with colorectal cancer screening, which I think everybody struggles to get patients adherent to that? What are some strategies we can do to improve those so that the patients are more engaged and do participate and get those tests performed?
I want to thank you for your time joining us here today on the eClinicalWorks podcast, and we'll look forward to seeing what else HHM does going forward.
Absolutely. Thank you for having me. And at HHM, we just want to continue doing the best work that we can to the highest level we can. So thank eClinicalWorks for giving us a tool to be able to do that too.
We'll be there with you, Gela. If you'd like to learn anything more about the topics that we discussed here today, the PCMH analytics, the HEDIS analytics, or much more, you can visit eClinicalWorks.com or my.eClinicalWorks.com, or speak with your strategic account manager. You can also make sure to check out our eClinicalWorks podcasts. Make sure you subscribe so that you can keep in touch with the conversation. And you can find those on Apple Podcasts, YouTube, and a variety of other platforms that grow every single day. For the eClinicalWorks podcast, I'm Adam Salati, and thank you for watching.